Assalamu alaikum. In today's lecture, we are going to discuss about beta blockers. So, beta blockers, also known as beta-adrenergic blocking agents, are the medication that reduce blood pressure. This is the main or the simple definition of beta blockers. Subtypes: cardio-selective beta blockers. They include atenolol, metoprolol, and nebuliol. They act only on the heart. Okay. Cardiac non-selective beta blockers. They act hard on the lungs as well. They include propranolol, nadolol, and mixed alpha and beta antagonist like labetalol and carvedol. There is another category that is partial agonist like pindalol and S-butalol. They stimulate mildly when receptor is inactive and inhibit when receptor is active. Okay. If we discuss it as class 2 antiarrhythmic drugs, beta blocker as tachycardia and antiarrhythmic drugs. They work by depression of SA node. It slows automaticity. Let me explain the normal physiology first. Beta 1 stimulation results in increase in the slow sodium current of action potential in phase 4 in the SA node. Okay. This results in faster rising and shorter phase 4. Faster rising and shorter phase 4. Ultimately, a shorter time to the next heartbeat. Thus, a faster heart rate. So when beta blockers given, they oppose this action, slowing down the SA pacemaker. Okay. Now let's explore depression of the AV node, prolong the refractory period. First we discuss about SA node, now we are discussing about AV node. A decrease in slow sodium current if it leaves the AV node in a refractory state longer. As a result, a long PR interval and a fast degree AV block. Prevention of depolarization. After depolarization, produce premature ventricular contraction, which can deteriorate into ventricular tachycardia or ventricular fibrillation. So in summary, beta blockers can be useful in tachycardia and arrhythmia. This anticardiac and antiarrhythmic effects achieved by depression of the SA node which slows automaticity, depression of the AV node via prolongs the refractory period, and prevention and depolarization. I hope this makes sense. Discuss about pharmacokinetics. Short half-life and long half-life. The short half-life like 3 to 4 hours and the long half-life contains 10 to 20 hours. Example of the short half-life drugs are propranolol, metoprolol, and example of the long half-life drugs like nadolol and atenolol. Metoprolol is a lipid-soluble drug and therefore cross the blood-brain barrier. Okay. However, atenolol does not. Effects include hypotension, bradycardia and heart block, impotence, fatigue, hypoglycemia, Raynaud phenomena, and congestive heart failure. The contraindications. In asthma, because asthmatic patients should not use non-selective beta blockers as blocking may lead to bronchoconstriction. Okay. Second degree heart block is also contraindicated. Second degree heart block can be converted to third degree heart block, resulting in very low heart rate. So it is contraindicated in second degree heart block. Bradycardia. Beta blockers could make the already slow heart rate, so slow cardiac output and blood pressure fall below levels that are required by the body for the adequate perfusion. Okay. Acute heart failure. This is contraindicated. Note that congestive heart failure, chronic congestive heart failure is indication for beta blocker, but an acute heart failure is contraindicated. Okay. So this is all about beta blockers. I hope this makes sense. Kindly like the video and subscribe my channel for more videos, and support me through subscribing, sharing, and like and comment your opinions. Thank you. Allah Hafiz.